Hello, my name is Sarah, and we are Group 2. Our members include Regine, Haley, Gina, Michelle, and myself. Our analysis focused on evaluating sociodemographic factors impacting unplanned hospital visits, specifically poverty and population density. We utilized three data sets: unplanned hospital visits, poverty estimates, and rural-urban continuum codes, or RUCCs. The RUCCs categorize counties based on their metro or non-metro status, allowing us to merge all three datasets by county name. Our initial investigation into poverty required an in-depth understanding of household income level nationwide, which Regine will go into now.
So first we needed to describe the median household income, MHI, estimate of poverty, ages 0 to 17, and estimate of poverty, all ages for each state. So first we created a parameter to include all three measures and inputted it into a calculated field using a case function. And here median household income is represented in the thousands, and the light blue to dark blue gradient represents low to higher levels of average income by state. Next, we wanted to describe how population density impacted hospital outcomes by using the RUCCs, which categorize counties from metro, urban, and rural. By utilizing a donut chart with the county data, we were able to compare the number of hospitals reporting outcomes as worse or better than the national rate across the RUCC types. And with a measure name filter, we can easily select which measures to view. Next will be Michelle with our poverty dashboard.
Hi, thanks, Regine. So first, we wanted to explore the relationship between general poverty and youth poverty on type of unplanned hospital visits. You can see the results in our horizontal bar chart, where we found that levels of youth poverty in a county have greater impact than general poverty on hospital readmissions and lead to higher rates of readmission than the national rates on all measures. Because of the greater impact from youth poverty, we wanted to look more deeply into the impact of youth poverty on hospital outcomes. Specifically, we wondered how increasing levels of youth poverty in a county would impact hospital-wide readmissions compared to the national rate. On the bottom left, you see our trend line that shows the average percent of the population of youth in poverty and the percent of the total count of hospital-wide readmissions compared to the national rate. While we did find a positive trend line, it was of a low R-squared value, which means that there are likely other more relevant variables that determine if hospitals will continue to have more hospital-wide readmissions when compared to the national rate. Next, we wanted to describe the relationship between population density and levels of youth poverty. In the lower right portion of our dashboard, we have a tree map, which shows the percentage of poverty in youth for each RUCC type. We found that generally there is a strong correlation between population density and youth poverty, with the percentage of youth poverty increasing as population density decreases. And next, Gina will go more deeply into population density.
Our objective for this dashboard was to analyze income disparities among the metro, urban, and rural categories of the RUCC groups to explore the impact of poverty on hospital-wide readmissions. The trend lines for each group revealed a weak correlation between poverty and readmission rates, with the R-squared values of 0.04, 0.02, and 0.12, respectively. This suggests that poverty alone is not a strong predictor of hospital readmissions. However, the bar graph clearly illustrates a significant income disparity between rural areas and metro-urban areas, indicating that the necessity for targeted healthcare interventions in rural regions to alleviate the adverse effects of lower incomes on healthcare outcomes. Next will be Haley with our conclusion.
Thank you, Gina. This type of research is relevant for informing public health programming and initiatives, as well as local and national health organizations. In terms of building upon our model, future research could include looking at other social determinants of health for populations that may impact outcomes, such as patient education levels, access to care and nutritious foods, and barriers such as language and transportation. Investigating additional social determinants of health on unplanned hospital visits can lend support during review of government-supported safety net programs, reassessing possible demographics to include in census tracking, and community outreach programs. Thank you for listening to our presentation.